Hello, everyone. My name is Edwina Mensa, and today I'm going to be presenting on drug addiction and overdose for the public health biology class. So, to start with, we're going to be talking about the purpose and objective of this presentation. The purpose of this presentation is to spread light on a common issue within our society that is often ignored, such as the effects of drug addiction and overdose. This information can serve to help others in need. As we know, drugs can come in a various amount of forms. So, there is a liquid form, which is like in maybe bottles or maybe through like needles and stuff. And then there's also pill form, which is much more common and much more where we see people like getting addicted to and dying from a lot. Next, we're going to talk about my table of content. So this is just all the information that focuses on what I'm going to be presenting today. So we're going to talk about the definition of both drug addiction and overdose, the signs and symptoms, the causes and origin, the spread and prevention, the treatment plans that are available, some statistics about both the drug addiction and overdose, and a summary and question slide just to give you guys some questions to consider, kind of summarize what you should know or what you should have learned from this presentation, and then my reference slide. So, the definition of a drug addiction is a chronic relapsing disorder characterized by compulsive drug seeking and use despite consequences. So, drug addiction is a chronic disorder. And as you can kind of see in the picture of this guy laying on his table with the pills out and the alcohol, a lot of people like to mix their drugs or abuse any type of substances with alcohol. So, despite the consequences of what the drug can do to their body, they take multiple or however they are going about it, is kind of what we have to like pay attention to. Because despite the consequences or despite them knowing the consequences, they still are like, trying to get the drug, trying to get a feel of the drug. A lot of people use it to feel normal. A lot of people use it just because. So they know what the consequences are, but they do not care just because they are actively seeking to get the drug into their system any way possible. And then we have the opposite, which is a drug overdose. So a drug overdose is when you take a toxic, which is also known as a poisonous amount of the drug or medicine, which results in the fatal adverse reactions. So drug overdose, it's a little bit different than the drug addiction. Drug addiction, you're more so, you take the pill once and then you just start getting compulsive like characterizations to like keep taking the drug. But for a drug overdose, sometimes it could be something that you don't realize is happening to you, and sometimes it could be something that's what's like intentionally happening. So we're going to talk about that in a couple more slides. But drug overdose, it's more fatal just because you have certain like reactions such as like I believe foaming of the mouth. You can pass out. So there's so many different like fatal reactions that can happen when you do take something of high substance without even realizing that you're, taking something that's not good for your body. All right. And now we're going to talk about the signs and symptoms. So drug addiction and overdose, they kind of have similar symptoms, but not too much of the similar. So for drug addiction, there's definitely like repercussions in the work and home life. If you take it, it definitely can lead to more issues in your work and home life, especially if you are around people who know who you are or people who like you work with. They can just kind of see like the different changes in you. Drastic mood swings is definitely another one that can happen or that you will notice. We have hyperactivity where you're just like always on the go, always ready to run around. Psychosis and intense urges for the drug. So these all are behavioral signs and symptoms because these are some things that are your behavior or what your behavior is producing. Whereas we have a physical sign and symptom, which is your irregular heartbeat and hyperactivity as well. So this is something that is physically going on. Like you physically feel like your heart is not beating regularly. So that's some of the signs and symptoms of a drug addiction. And then when we go to drug overdose, so behavioral is only, I believe there is more, but so far I believe hallucinating is the very most common one. So, when you hallucinate, are not in a really clear state of mind. You're not in reality. So you don't know what's going on around you, but you're just like looking at different things and seeing different things in your eyes. And then we have physical, which is nausea, seizures, pinpoint and constricted pupils. So when your eyes are like dilating or constricting, an increase in body temperatures, high blood pressure, stroke, difficulty breathing, drowsiness. So all of these symptoms and signs are physical, as these are things that are happening on your body that you can physically see, that other people can also physically see as well, especially with drowsiness. People can see when you're tired, or you can even feel when you're tired. Difficulty breathing, when the drug has activated your system or has done whatever it has done, like you can not breathe. Like it can cause like a lot of hallucinations, which can lead to all of these like physical symptoms. Now we're going to talk about some of the causes and origins for both a drug addiction and drug overdose. So for a drug addiction, is experimental use in social situations. So there is a lot of times when you are in a social environment or with peers or whoever, and you feel the need to try to fit in, try to, be cool with them. And there is a lot of peer pressuring that goes along. So you will feel peer pressured to want to use like a drug in a social situation. So if you go to a party and people are drinking or people are, taking pills, you'll feel the need to feel included or to be involved. You want to also do that as well. And then we have genetics, which also ties into like genetic factors. We have environmental factors, so like the environments around you, whether it be at work, at school, like at a party, just in general, environmental factors. And then you also have curiosity. And I believe curiosity is one of the biggest ones, just because, aside from peer pressure, because everyone is always curious about something. So I definitely think that once you see something for the first time, and once you see someone doing something for the first time, it will strike some curiosity in you to think like, oh, should I be doing this, or do I want to try this? So those are some things to keep in mind. For a drug overdose, we have two different types. So you can have something that's accidental and you can have something that's intentional. So an accidental drug overdose is when a person takes the wrong substance or combination of substances in the wrong amount or at the wrong time. So when a person takes a wrong substance, so let's say like you're laying at home and you want to just take a drug, but you don't realize the amount of the drug that you're taking, because a lot of people, what they tend to do is they switch the pills that are meant, or whatever like substance that they're using, they switch it and put it in a different bottle. So once you read the bottle and you look at the pills, you're not going to really know if the pill is in the correct bottle label. So that will be taking like the wrong amount at the wrong time. Intentional overdose is when a person takes an intentionally harmful dose of a substance or combination of substances. So these type of intentional things kind of lead to like suicide and all those other like factors, because like what you're doing, specifically how harmful the dose is. You're taking the dose yourself or someone is giving it to you, however the case may be, but specifically like what you're doing and how harmful the substance will be, or the substances that you are combining will be. And now we're going to move on to the spread and prevention. So, the spread of this disease can definitely be like aggressive behaviors. That's sign of the couple of the things that happen, like having aggressive behavior during your childhood. Community poverty is definitely one. So, like if you're poor or living in a poor community, you feel the need to kind of like do what you can to kind of get out of poverty. We have drug experimentation, which I spoke about on the previous slide, where you want to experience or be a part of like social interactions, social situations. So you want to experiment with a drug. For more so for teens and kids, I would say it's lack of parental supervision. If your parents are not around, you'll feel more inclined to do things that you're not supposed to do. So I believe that definitely plays a factor into like how it spreads, like for taking drugs. And availability of drugs at school. Like schools have become more, I would say, freely, as a lot of students have the ability or the access to obtain these types of substances without being like properly checked at school, and they would encourage their friends or encourage whoever to like take these substances and try it. So I definitely feel like the availability of drugs at school also plays a part into like the spread of like the drugs. And then prevention, definitely promoting healthy coping mechanisms. So if something is wrong with you, or if you're going through a very, very tough or harsh situation, it's very important for you to practice or promote or find some different way to cope instead of like resulting to substances. There's definitely things that you can do, whether that be therapy or, talking to friends, going on a walk. There's definitely many things that you can do. So it's just important to find something that's working for you that will not ever like lead you or divert you into the motion of having to do drugs. And then we have developing healthy habits. So definitely incorporating a good routine for you, always like making sure like everything that you do is helping your body, helping your mental health and everything like that, just to make sure like you are developing a healthy habit and not ever like gonna seek down a path of doing a bad habit. Definitely reading medication labels carefully. This also ties into taking prescribed medication as directed. When you are prescribed any medication from a facility, a doctor, provider, whoever it is, please make sure to always read your medication label carefully as possible. Make sure to follow all the directions and make sure to never switch the pills that you are prescribed in a different bottle or an empty bottle. Just make sure like every medication you have is consistent. And if you have any questions about it, if you're concerned about it, be sure to ask a provider or ask someone near you. And then always educate others on the dangers of the drug addiction and overdose, because these are serious conditions that are happening in our daily lives. These are what things people are dying from. It's very important for us to take and be aware of these things, because it's becoming increasingly dangerous to associate yourself with drugs. And some people have gotten to the point where they don't even want to take any medication, even if they are in pain, just to prevent or not go down the path of being a drug addict or having an overdose. And now we're going to talk about treatment. So there is a withdrawal therapy, which kind of like helps you go through the motions of withdrawing from the drug and like letting it release from your body. There are different types of medications that you can be prescribed to reduce your cravings. Behavior therapy, just making sure like your behavior is like not like easily triggered to go down the path of taking drugs. We have hospital treatment, which includes like a full physical exam and antidote. So when you go to the hospital, I believe they allow you to get some type of charcoal treatment, which also ties into the self-care treatment, which kind of just helps you to like release the drug from your system and helps you to like fully cleanse your body or fully cleanse the drug out of your body. And then we have safe prescribing practices. So this is important because definitely when you go to a doctor's office and you're prescribed any type of medicine, it's always better to make sure it is safe for you to be prescribed, and it's coming from a good place. So what I mean by that is like, some people get their drugs or get like any type of medication from others. So it's not people that are like a hospital or a provider. It's from like friends or family or drug dealers or someone else, someone who is capable of prescribing, but it's not a safe prescribing practice. We have education and awareness sessions. So these are very important to just make yourself fully aware, even if the situation is not happening to you, even if nothing of this is happening to you. But if you know someone who is happening to, it's definitely good for you both to be aware and go to these sessions to make sure like you are consistently updated with the knowledge that you need to ensure that you don't go down a bad path. And then lastly, we have interventions for harm reduction. So definitely, I do know that like when you do take drugs or when you do intake drugs, sometimes it could lead to you wanting to harm yourself or whatever the case may be. So definitely attending sessions like that or having an intervention where you're preventing that is important, just to make sure like you're not doing something that you should not be doing or that could be harmful to you and somebody else. So here we have some statistics. So we have on the left about drug use only, and then on the right is about the total overdose of drugs and like kind of the deaths that come along with it. So first, to dive into the drug use. So this graph is specifically of Americans who are aged 12 years or older, and they have broken down the drugs into their specific names. And then we kind of have three different notifications here, three different like key terms to look at. So we have the blue line, which talks about the use of drugs in a lifetime. So this is all of their lives. And then we have the use of drugs in the last year, which is the green line. So just like, I believe this graph is from 2020. That's the most recent data we have currently because, times are changing. And then we have the gray graph, or the gray line, I should say, which is used in the last month. So we have a very big, a decrease in the amount of usage per like these three different categories. So we see marijuana is the most commonly used drug, and this is because there are so many weed shops in the world. There's so many, and now that is legalized in New York or legalized in the United States, I believe it is. We see that there's more and more, advances for you to get drugs. We kind of see heroin as like the least common, and then for marijuana it just kind of goes down, but we see marijuana as the most commonly used, so that's something to just keep in mind moving forward. And then we have the total overdose deaths by state. So this is really important. I believe the one on the left, the very dark blue one, is California. Correct me if I'm wrong. I don't really know my states, but I think that is California. And as we can see, that's the most commonly amount of overdoses that are happening. And that's about 6,000. So that's incredibly terrible that it has even gotten up to that amount. And then we have other states which have like about 5,000, 3,000, 4,000. So it's definitely, if you know someone who is in the midst of taking drugs, or you know someone who has had an overdose, please give them the resources that they need, because we want to prevent these deaths from occurring even more. And this data was from 2023. So now we have our summary slide and questions. So just a summary about what we discussed today. Drug addiction and overdose are complex situations that require the utmost care to ensure treatment is successful. More research should be done to prevent and find more treatments to reduce the burden of drug addiction and overdose on individuals, communities, and support systems. So once again, if you know someone who is indulging in drugs, please reach out to them. Please let them know about the dangers and effects of these things on their body, on their health, just in general. And if you are someone who is in the midst of doing drugs, just please make yourself aware of everything that's going on, because it can lead to a death, and you want to prevent that as much as possible. It could also lead to harm prevention, harm indication. So you just want to be mindful of everything that you're doing, everything you're incorporating in your body. And please double check if it's safe, if it's healthy, if it's something that you should be incorporating. And just some questions to consider. So what are the economic and social impacts of drug addiction on individuals and society? That's a very important question, because we are looking at the effects of them, but we're not really paying attention to the economic and social impacts of them on everybody. Because economically, I believe it does cost a lot of money, and you are producing a lot of money when you are partaking in these two things. And then we have, what are the physiological mechanisms of overdose, and how do they vary depending on the drug? So there's different types of mechanisms for various drugs. So definitely it's good to pay attention on how the overdose plays a role on these types of drugs. And then we have, what are the legal and ethical considerations surrounding drug addiction and treatment and overdose prevention? So I'm pretty sure there are legal binding things or ethical things that you need to be aware of too. I'm not really sure if anybody has a contract with them, but that's something to kind of keep in mind, something to be considered. But legal and ethical considerations are important as well. And then, how does drug addiction affect the brain and behavior over time? That's something that I believe there should be studies upon that, because that can kind of give people the kind of sense of idea of what to be aware of moving forward, especially because of how behavior changes, with the drastic mood swings and all the physical things that happen. And then definitely your brain. We don't know, or we haven't dived deep into how this can alter your brain, but that's something to keep in mind and something to pay attention to. And then we just have my reference slides. So thank you guys so much for listening, and goodbye.